Hello, gentlemen. If you are over 50 or 60 or beyond, and you have noticed that your moments of intimacy feel different, especially if you experience the full sensation of pleasure, that moment of climax, but without the expected presence of seminal fluid, this message is absolutely essential. Maybe it happened just once and instantly triggered a knot of worry in your stomach, or perhaps it is a recurring silent issue you have been keeping to yourself, feeling a sense of shame or a quiet fear about what it might mean for your health and your future. I am Dr. Sofia, a urologist with over 12 years of experience focusing on men's vital health at every stage of life. And today, I want to have a serious but profoundly supportive conversation with you that is rooted in medical understanding, compassion, and clarity. First and most importantly, I want you to know that I understand your concern. The change you are noticing in your body is not a sign that your masculinity has expired or that your intimate life is over. Think of it this way. It is not a failure. It is a detailed message your body is sending you, and that message simply needs to be decoded and understood properly. Stay with me because in the next few minutes we are going to explore the surprising causes, the critical warning signs, and most importantly, the clear, manageable solutions modern medicine offers to restore your peace of mind, confidence, and overall well-being, while also helping you understand your body at a deeper level. Before we dive into what happens when the fluid is absent, let us take a quick non-textbook look at how this process should work normally. Think of your body's reproductive system as a perfectly timed orchestra working in harmony. The testicles produce the sperm. The seminal vesicles contribute the bulk of the nourishing rich fluid that supports sperm health. The prostate adds a protective fluid that helps with mobility and balance. This final mixture is gathered and prepared in the urethra. When climax hits, specific muscles contract in a powerful rhythmic sequence to propel that fluid mixture forward and out. It is a rapid event, and it is the result of delicate synchronized timing between nerves, glands, muscles, blood flow, and hormonal signals all working together in a very precise way. Now here is a crucial distinction, gentlemen. Climax and ejaculation are not the same thing, even though they usually occur together. Climax is the neurological sensation of intense pleasure governed by your brain, spinal cord, and nervous system. Ejaculation is the physical act of expelling the fluid from the body. Most of your life, they happen seamlessly as one event, but they are driven by separate mechanisms. Our focus today is on dry ejaculation, which is the technical term for when a man reaches climax, feels that characteristic pleasure, but notices little to no fluid is released. Many men describe this to me in my office as an empty orgasm, and that gap between what is expected and what actually happens fuels worry, anxiety, and confusion. I understand that because you have always expected a physical sign of the event, but it is vital to understand that your ability to feel pleasure can remain fully intact, governed by your nerves and brain. The change is happening in the mechanical delivery system, and this does not mean you have lost your virility or identity as a man. It simply means part of your body's plumbing has a specific, identifiable reason for the change. Quick pause before we go deeper. If you find this information helpful, please take a moment to support this message. Like this video, subscribe to the channel, and share where you are watching from. There is strength in knowing that men across the world are learning, supporting, and taking control of their health together. Now let us break down the 3 most common causes of dry ejaculation, because knowing the why is the first step to feeling calm, informed, and in control. The first cause is what I call the gatekeeper being too relaxed, which is medically known as retrograde ejaculation. Picture a small muscular valve at the exit of your bladder that acts like a gatekeeper. During climax, this valve should clamp down tightly, ensuring the seminal fluid has only one way to go forward and out. If this valve is too relaxed, the fluid follows the path of least resistance and flows backward into the bladder instead. You still feel the full pleasure of climax, but since the fluid does not exit the body, it feels dry. A common and usually non-alarming clue is noticing that your urine looks cloudier right after intimacy, because the fluid is now mixing with it. This often happens after certain surgeries on the prostate or bladder, which are successful and necessary, but can affect the delicate nerves controlling this gate. It can also be a side effect of specific medications used to treat conditions like high blood pressure or an enlarged prostate. These medicines relax smooth muscles, which helps one problem, but also relaxes that tiny valve. I remember a patient who was deeply distressed after a successful prostate procedure. Once he understood it was purely a mechanical change, like a traffic light stuck open, and that his desire and pleasure were completely unaffected, he felt enormous relief and regained confidence. The second major cause is when the plumbing is blocked, which we call duct obstruction. In this case, the seminal vesicles and glands are producing the fluid normally, but the small ducts that act like delivery pipes are blocked. When those pipes are blocked, the fluid cannot pass through, even though production is fine. As a result, the volume drastically decreases or disappears. Causes for these blockages can include scarring left behind by past infections, such as severe or untreated prostatitis. In rare cases, small calcifications like tiny stones can form and block the passage. The symptoms can be subtle, but some men report mild discomfort in the pelvis during climax or notice that the fluid became progressively thicker and less abundant over time. The encouraging news is that many of these obstructions can be treated often with medication to reduce inflammation or with minimally invasive procedures that restore normal flow and function. The third major area to investigate involves hormonal factors, especially low testosterone. Testosterone is the primary fuel for the male reproductive system. It does not just regulate desire and sperm production. It is crucial for the optimal function of the prostate and seminal vesicles, which produce most of the fluid. When testosterone levels drop significantly, the entire system slows down. At first, you may notice reduced volume, but over time, this deficiency can show up as decreased libido, less firm erections, reduced energy, and a less intense sensation of climax. Many men also experience fatigue, mood changes, sleep disruption, and loss of muscle mass. This condition, often called hypogonadism, is a treatable hormonal imbalance. A simple blood test can confirm it, and carefully monitored hormone therapy can restore not only fluid production, but also vitality, confidence, mental clarity, and overall quality of life. It is important not to dismiss these changes as just aging when effective solutions exist. While most of these causes are manageable, I must also address the critical exceptions. Dry ejaculation can sometimes be a warning sign of a more serious condition, which is why paying attention to additional symptoms matters. If this change appears suddenly without explanation, especially if it is accompanied by pain, blood in the urine, or fluid fever, numbness, or loss of sensation in the genital area, do not wait. These signs require immediate medical evaluation. Certain neurological conditions, long-standing uncontrolled diabetes, and in rare cases specific urological cancers can interfere with nerve signals or mechanical pathways. Early evaluation can make a meaningful difference. Beyond the physical, we must talk about the emotional impact. Many men associate the presence of fluid with performance masculinity and self-worth. When it disappears, feelings of inadequacy, anxiety, and frustration can quietly grow. Some men begin avoiding intimacy altogether out of fear of judgment or embarrassment. This emotional burden is real, and it deserves attention. Understanding that this is a physiological change, not a personal failure, lifts a tremendous weight. Your ability to feel pleasure, maintain erections, and enjoy intimacy does not depend solely on fluid volume. Your intimate life can remain fulfilling, meaningful, and deeply connected. To wrap up, I want to leave you with a clear, supportive action plan. Do not ignore the change. Investigate it. A sudden or gradual onset of dry ejaculation deserves a conversation with a urologist. A medical history, physical exam, and simple blood or urine tests often provide clear answers. Control underlying conditions such as diabetes, high blood pressure, and cholesterol because they directly affect nerve and vascular health. Break the silence by talking openly with your partner and your doctor because communication leads to relief and solutions. Professional guidance, whether through medication adjustments or targeted treatment, is one of the most effective ways to restore confidence and peace of mind. In summary, gentlemen, the absence of ejaculation is not the end of your intimate life, and it is not a judgment on your masculinity. It is a signal from your body asking to be understood. Identifying whether the cause is mechanical, obstructive, or hormonal is the first step toward clarity and reassurance. I have seen countless men regain confidence, vitality, and joy after receiving a clear diagnosis and personalized plan. Your vitality is not measured in milliliters of fluid, but in your health, your well-being, and your ability to live fully and connect deeply. Do not let doubt or shame stop you from seeking answers, because timely action can transform your experience and restore the sense of security and intimacy you deserve. If this message helped you, please share it with a friend, father, or brother, because this information can genuinely change someone's perspective. Support the channel so this message reaches more men who need it. Remember, your best years can still be ahead of you. Be proactive, be confident, and stay blessed. I am Dr. Sofia, and I will see you in the next conversation on men's vital health.